off her heart rate, which is normal. Listen to that. Just put its arm over its chest. Sounds fine. Sweetie. Now I'm going to measure baby's abdomen. Yeah, I'm trying to see the upper lip to see if there are any signs of cleft lip. This looks normal. I'll show you here in just a sec. So this little dark space is where the lips meet. This is the upper lip. That's the tip of the nose. As far as we can tell at this point, that looks normal. Look at your little spine now, sweetie. So there's the neck and the upper half of the back. See where the little ribs come off the thoracic spine, all the way down to the little tailbone here. Little one looking right out at you, right out at the screen. Little eye. That's what I lovingly call that alien baby face shot. You gotta remember, they don't have any meat on their bones yet. They're pretty much, you know, skin over bone. Very still here all of a sudden. Wiggly when we started. So there's little mouth and nose, eye. Baby's belly, couple ribs there. That's a little fist right there.
Is it about 5 inches or 8 inches? I see different things.
Usually about 7 inches are in this stage.
It's a pretty good size.
Yeah, well, probably about 8 or 9 ounces. So there's a little profile, little nose right there. They still look a little scary even on the 3D at this stage. And that's little head there. I'll tell you what, let's have you roll on your side. Put that hand up there. Face right against the placenta, sweetie. There you are. A little mouth and eye, little arm there. The other arm is right there.
Okay.
So you don't see, this is the placenta right there, but there's the mouth, the nose, one of the eyes. There's the little hand down to the elbow. That's baby's belly. I was hoping to get the baby to turn because it's looking right up at the placenta, which makes it harder to see when they kind of stick their nose against the placenta.
To line 6 is Debbie Bullitt.
See how the face is almost touching the placenta there. Come on, sweetie. You need to wiggle for us. We're going to go see what you're having. like your hand in front of your face, don't you, baby?
It's like an astounding.
Only by pure chance at this point. They don't have that fine motor coordination to truly stick their hand in their mouth.
Yeah.
It's like if they find it, fine. If they don't, well, you know. It's still a learning process for them. All right, go ahead and lie back onto your back. Let's see if all right, so there's a leg. What did you bring your hand down here? Oh, there's a foot. Look at the toes. Okay, crossing your feet Indian style with your feet against your rump does not work, baby. Come on. Oh, need to move. They sure did. Look at that. Those feet are just like, boom, right there, right where we need to look. I don't give up easy, though.
I can run.
See that? That's a boy.
Woohoo!
Girls don't have things like that between their legs.
I can't tell what it
Well, that's
is.
his testes and that's his penis. Go ahead and lie back on your back.
Yeah.